So pacemakers are small electrical devices that are implanted under the skin, usually on the top left or the top right of the chest. And what pacemakers do essentially is they monitor your heart rhythm. And if your heart's going too slowly, or if the coordination between the chambers of the heart goes out of rhythm, pacemakers detect this and they try and correct it by pacing the heart. So essentially pacemakers are small devices that deliver little electrical pulses to the heart to correct any heart rhythm abnormalities that might give you symptoms such as dizziness or fainting. Pacemakers are fitted with a local anaesthetic procedure. It takes usually less than an hour to put a pacemaker in, so the patient is awake for the procedure, and the patient can have some sedation if needs be to make them a bit more relaxed, but most of the time it's not necessary. We inject local anaesthetic into the area we're operating on, at the top left or the top right of the chest usually, make a small cut a few centimetres wide, and then put 1 or 2 or sometimes 3 leads down a vein into the heart. The patient doesn't feel any of this because it's all numbed with the anaesthetic. We position the leads inside the heart using X-ray guidance. It's all just done through a small cut at the top of the chest. It's not a big open operation. And once we're happy with the positioning of the leads in the heart, we stitch everything back up again. As I say, the whole operation just takes less than an hour or so, and the patient usually goes home the same day. Any procedure carries a small amount of risk, but actually pacemaker implantation is a procedure rather than an operation, technically speaking, and the risk is extremely low. The risk of a serious complication being significantly less than 1 in 100, chance of any complication about 2 or 3 in 100, but most of these complications are very mild and can be easily fixed. So certainly the benefits of having a pacemaker as and when it's required hugely outweigh the risks, and it's not a big operation like some heart procedures are. Pacemakers are implanted for a variety of reasons, and there are a variety of different types of pacemaker. The most common reason for putting a pacemaker in is due to slow heart rhythms. So sometimes due to conditions of the heart, or sometimes due to aging of the heart, the speed of the heart can slow down. And sometimes that can cause symptoms such as dizziness, fainting, sometimes breathlessness or fatigue. And a pacemaker can correct that by speeding the heart up and keeping the heart ticking at the right speed. There are various other things we put pacemakers in for. So for example, some people develop conditions where the conduction of electricity through the heart goes wrong, and the chambers can beat in an uncoordinated fashion, and pacemakers can correct that for you. And in some people, we implant more complex pacemakers for treating heart failure or for treating or preventing potentially dangerous or life-threatening heart rhythms as well. So there are different types of pacemaker. There's a variety of reasons why we put them in, but certainly your consultant cardiologist would be able to guide you through what to do and what the right thing for you is in conjunction with the patient as and when required. Pacemaker batteries are a bit like the battery on your mobile phone, and it's quite predictable when the battery dies. So once you have a pacemaker in, you'll have regular checkups of your pacemaker in a pacemaker clinic. And when you have those checkups, the pacemaker will tell the specialist in the clinic how long you've got left on your battery, essentially. And the average pacemaker battery lasts about 10 years or so. As and when the battery is beginning to go a little bit flat, what we do is we book you in for what's called a generator change, or sometimes called a box change, which again is a local anaesthetic procedure. We inject local anaesthetic over where the pacemaker is, make a small cut a few centimetres wide over the pacemaker, take the old pacemaker out, put a new pacemaker in, just the top bit. We actually leave the leads in place, but then we stitch everything up, and again you go home the same day. So that usually takes about 20 minutes to half an hour to do. It's a relatively minor procedure. Pacemakers themselves shouldn't, once they're healed up and there's no more discomfort from where the pacemaker's gone in, which is usually a couple of weeks after the operation, pacemakers shouldn't really affect your sleep at all, actually. Some people find that they prefer sleeping on the side away from the pacemaker just so they're not pressing on it, but actually the majority of cases, pacemakers are so small and so thin these days that actually once it's all healed up and settled in, you should hardly notice it's there. And sleeping on either side should be no problems at all. So no, they shouldn't really affect your sleep in the long term.